unprecedented. We haven't seen this kind of surge in NCR. This is a nightmare happening to us right now.
The ongoing surge is bad enough, but in an interview with One News The Chiefs, the OCTA Research Group says it's going to get even worse before it begins to get better.
Actually, the next 2 weeks are a done deal already. This surge has a momentum. It's going to get worse before it gets better.
In fact, the group says that if the surge continues unabated, 8.5 million people in Metro Manila will have been infected by the end of June. That's already 70% of the population of the National Capital Region.
These are actual projections na by June 30 we'll reach 8.5 million total cases if this trend reproduction number continues.
David remarked that this is not a good way to achieve herd immunity. Herd immunity is when 70% of the population gets enough antibodies to stop the spread of a disease. Ideally, it is done through vaccination, but in Metro Manila's case, it might just be done through infection.
If this trend continues, by June 30, we will achieve herd immunity. 8.5 million people in NCR.
OCTA projects new daily infections to hit 10,000 per day by the end of March. In 2 weeks, David says hospitals will be choking with patients again.
In line with what's happening with the trends right now, then we just have 2 weeks before the hospitals reach 70% critical care limit. So that's the critical threshold set by the Department of Health.
To stem the surge, the government has ordered a virtual bubble around to restrict mobility in and around Metro Manila. But in the end, the group says every person has an important role in stopping the surge.
I would treat everyone I encounter as potentially having the virus and act accordingly.
With the arrival of the vaccine and the implementation of stronger health protocols, we have a better chance in flattening the curve. Let's just hope that the infection doesn't catch up with our preparation. I'm Jacob Lazaro, and we are One News.